it's an untreatable infection because of this single obstruction. So this man got to the hospital complaining about a kind of chronic sinus infection, a chronic sinusitis that just wouldn't go away. He said he had already completed a few antibiotic courses, but the symptoms were still there. They would diminish a bit and just go back as they were before starting the treatment. So he also said he had his teeth done a few weeks back, right before starting to feel this nose and sinus infection symptoms, and he wondered if it couldn't be related, if one thing couldn't be related to the other. So the doctor ordered a CT scan of the face and the paranasal sinus, and we actually found out why he was having such a bad time after a implant of teeth, of new teeth, a prosthetics teeth job. So let's see. This is a CT scan of the paranasal sinus of this man that complains of chronic sinusitis, probably related to some kind of dentistry procedure. So let's see. We have, of course, a soft tissue window that we look for inflammation of soft tissue parts, and we can actually measure attenuation and look for calcifications of the components of a sinusitis, such as this one on the maxillary sinus to the left, right at the location where the patient said he felt pain and nasal discharge and all those horrid symptoms of chronic sinusitis. Also, we can look at the orbits and whatnot. And we also have a window, a reconstruction of those images to better access the bones. We have a bone window volume right here. So let's start with the soft tissue. Let's look for soft tissue lesions. We can see right here that we have some kind of anomalous material filling up entirely the left maxillary sinus and the middle meatus of the nose of the left nasal fossa. The orbits are fine. The masticatory space, masticatory spaces are all right. We have a bunch of signs of chronic infection to the tonsils right here. The palatine tonsils are asymmetrical, partially calcified, and a bit enlarged. This is chronic infection. This is pretty common on elderly patients, such as this case. So this isn't really a justification for the symptoms of this patient. So let's hit the MPR button, the multiplanar reconstruction, and of course analyze these images on the best plane to analyze a sinus tract on the CT scan. So this is coronal. So coronal soft tissue window, we can see there is actual sinusitis to the left, and we can see there is a bunch of metal parts irradiating a bunch of artifacts on the teeth. This tells us, yes, the patient actually had a bunch of implants to the teeth, at least the upper teeth, maybe both. The sinus acquisition didn't get all the way to the bottom of the face, to the entirety of the mandible. So this is all what we have. The base of the skull is okay, but we aren't actually analyzing bone. So most of the sinus analysis is through a bone window. So this is the bone window. We know we have sinusitis, so this is sinusitis. See how different the attenuation of the content of the sinus is if you compare the soft tissue window, which can actually tell me this is heterogeneous, this is chronic infection, and the bone window, it's all kind of the same grayish tone, so this can be anything. And I can see that this maxillary sinus is actually chronically infected, chronically diseased, because the walls are thickened and irregular and kind of sclerotic. They are brighter than the contralateral sinus, and the walls are kind of thickened and irregular in contours. So this is really a chronic infection of the left maxillary sinus. And most sinus chronic infections are related to some kind of obstruction of that sinus. Most common ones are the maxillary chronic sinusitis. So let's see. We can see right here something really bright and odd localized at the outlet of this left maxillary sinus, which is chronic disease. This is of metallic attenuation, which is very odd, but not so odd as 3000 Hounsfield units. This is obviously metallic, and if you look right here, this is the exactly same morphology and attenuation. So this is a teeth implant, the base of a teeth implant, a screw, the anchor point of a teeth implant that was dislodged from right here on this kind of fractured and partially repaired bone of the alveoli, maxillary alveoli, or alveoli. I don't actually know how to pronounce that properly, but it was right here, and it was dislodged, it moved, it broke the bone and traveled upwards and inwards, and it got stuck at the outlet of the maxillary sinus, causing the obstruction that led to the chronic sinusitis. So unless this patient treats this obstruction by surgery and takes this off of this sinus outlet, this just won't go away. It's an untreatable infection because of this single obstruction. So this patient must go through some kind of nasal endoscopic surgery or open surgery to take this object from the outlet of the left maxillary sinus, so then we can actually treat the chronic sinusitis. Just as a reminder, as you may have guessed, this diagnosis could have been done by a simple X-ray of the face of the paranasal sinus. You see right here the teeth implants 1, 2, and 3 to the right, 1 and 2 to the left, and right here a dislodged implant that moved from right here to there, causing the chronic sinusitis. You can see here the right maxillary sinus is okay, it's normal, and the left is completely opacified, even on the X-ray, and right there on the topography of the outlet of that sinus there is a metallic object that resembles that it's exactly the same morphology and attenuation of the other anchor points of this prosthetic teeth, this teeth prosthesis. This is a chronic infection due to some accident during or just after a dentistry procedure. So this is it. I hope you have enjoyed this video. This is a very curious case, and if you're interested in other videos, just click here and keep watching. And until next time, take care.